Hey friends, welcome to Nursing Online Education. In this video, we will be discussing important question and answers of different nursing comparative examinations. Guys, let's get started. Here is our first question.
1. Which of the following anatomical terms best describes the motion in the picture above? A. Adduction. B. Abduction. C. Supination. D. Pronation. The answer is option B, abduction. 2. Which of the above locations represents the best sites to inspect chest retractions in a child with lower respiratory tract disorder? A. B, B, C, C, D, D, E. The answer is option D, E. 3. Your patient's finger stick blood sugar at 7:30 is 300 mg per dl. According to the following sliding scale, how many unites you would give your patient? 6 I.U, B 8 I.U, C 14 I.U, D 18 I.U. The answer is option C, 14 I.U. 4. The following syringe contains morphine sulfate in a concentration of 2 mg per cubic centimeter. How much total morphine this syringe contains? 0.5 mg, B 1 mg, C 2 mg, D 4 mg. The answer is option D, 4 mg. 5. The following syringe contains 2 gm of morphine sulfate. How many grams are there in 1 milliliter? A. 0.5 gm, B. 1 gm, C. 2 gm, D. 4 gm. The answer is option B, 1 gm. 6. The following condition may develop in females due to an increase in the production of which of the following hormones? A. Androgens, B. Progesterone, C. Estrogen, D. Growth. The answer is option A, androgens. 7. What is the name of the process of movement of a dissolved substance, solutes, from an area of high concentration to an area of low concentration? A. Effusion, B. Diffusion, C. Emulsion, D. Excretion. The answer is option B, diffusion. 8. Which of the following is the incision site for an open cholecystectomy operation? 1, B, 2, C, 3, D, 4. The answer is option B, 2. 9. Which of the following is the incision site for an open gastrectomy operation? 1, B, 2, C, 3, D, 4. The answer is option D, 4. 10. Which of the following is the incision site for surgical appendectomy operation? A, B, C, D, D. The answer is option C. 11. What is the most probable type of arrhythmia in the following ECG? Lead LL, A. Atrial fibrillation, B. Atrial flutter, C. Ventricular fibrillation, D. Supraventricular fibrillation. The answer is option A. Atrial fibrillation. 12. What is the most probable type of arrhythmia in the following ECG? Lead V1, A. Atrial fibrillation, B. Atrial flutter, C. Ventricular tachycardia, D. Supraventricular fibrillation. The answer is option C. Ventricular tachycardia. 13. The following picture suggests that the patient has A. Renal disease, B. Hepatic disease, C. Pulmonary disease, D. Cerebral disease. The answer is option C. Pulmonary disease. 14. When a patient is vomiting postoperatively, which of the following positions would the nurse use to protect the patient? A, B, C, D. The answer is option D. 15. The following picture represents the pain distribution of which nerve affection? C2, B, C6, C, T3, D, T6. The answer is option B, C6. 16. On assessing the client's pressure ulcer, see photo, the nurse would document this as which stage? Stage I, B, stage 2, C, stage 3, D, stage 4. The answer is option C, stage 3. 17. The following picture represents an autoimmune disease known as A. Psoriasis, B. Systemic lupus erythematosus, C. Molluscum contagiosum, D. Eczema. The answer is option B. Systemic lupus erythematosus. 18. What is the name of the equipment this picture shows? A. Oropharyngeal airway, OPA, B. Nasopharyngeal airway, NPA, C. Laryngeal mask airway, LMA, D. Urinary catheter. The answer is option B. Nasopharyngeal airway, NPA. 19. A client is being prepared for a thoracentesis. A nurse assists the client to which position for the procedure? Lying in bed on the affected side, B. Lying in bed on the unaffected side, C. Sims position with the head of the bed flat, D. Prone with the head turned to the side and supported by a pillow. The answer is option B. Lying in bed on the unaffected side. 20. A nurse is preparing to insert a nasogastric tube into a client. The nurse places the client in which position for insertion? Right side, B. Low Fowlers, C. High Fowlers, D. Supine with the head flat. The answer is option C. High Fowlers. 21. A nurse develops a plan of care for a client with deep vein thrombosis. Which client position or activity in the plan will be included? A. Out-of-bed activities as desired. B. Bedrest with the affected extremity kept flat. C. Bedrest with elevation of the affected extremity. D. Bedrest with the affected extremity in a dependent position. The answer is option C. Bedrest with elevation of the affected extremity. 22. A client in labor is transported to the delivery room and is prepared for a cesarean delivery. The client is transferred to the delivery room table, and the nurse places the client in the A. Trendelenburg's position with the legs in stirrups, B. Semi-Fowler position with a pillow under the knees, C. Prone position with the legs separated and elevated, D. Supine position with a wedge under the right hip. The answer is option D. Supine position with a wedge under the right hip. 23. The nurse is caring for a client who is 1 day postoperative for a total hip replacement. Which is the best position in which the nurse should place the client? Side lying on the operative side, B. On the non-operative side with the legs abducted, C. Side lying with the affected leg internally rotated, D. Side lying with the affected leg externally rotated. The answer is option B. On the non-operative side with the legs abducted. 24. Which of the following is the best position to increase the brain perfusion? Cerebral perfusion, prone, B. Supine, C. Semi-Fowlers, D. Trendelenburg's. The answer is option D. Trendelenburg's. 25. A nurse is administering a cleansing enema to a client with a fecal impaction. Before administering the enema, the nurse places the client in which position? Left Sims position, B. Right Sims position, C. On the left side of the body, with the head of the bed elevated 45 degrees, D. On the right side of the body, with the head of the bed elevated 45 degrees. The answer is option, left Sims position. 26. A client has just returned to a nursing unit after an above-knee amputation of the right leg. A nurse places the client in which position? Prone, B. Reverse Trendelenburg's, C. Supine, with the amputated limb flat on the bed, D. Supine, with the amputated limb supported with pillows. The answer is option D. Supine, with the amputated limb supported with pillows. 27. A nurse is caring for a client with a severe burn who is scheduled for an autograft to be placed on the lower extremity. The nurse develops a postoperative plan of care for the client and includes which of the following in the plan? A. Maintain the client in a prone position, B. Elevate and immobilize the grafted extremity, C. Maintain the surgical extremity in a flat position, D. Keep the surgical extremity covered with a blanket. The answer is option B. Elevate and immobilize the grafted extremity. 28. A nurse is preparing to care for a client who has returned to the nursing unit following cardiac catheterization performed through the femoral artery. The nurse checks the physician's prescription and plans to allow which client position or activity following the procedure. A. Bed rest in high Fowler's position. B. Bed rest with bathroom privileges only. C. Bed rest with head elevation at 60 degrees. D. Bed rest with head elevation no greater than 30 degrees. The answer is option D. Bed rest with head elevation no greater than 30 degrees. 29. After the client undergoes a total hip replacement, how should the nurse position the affected hip? A. Adduct the hip. B. Abduct the hip. C. Flex the hip. D. Extend the hip. The answer is option B. Abduct the hip. 30. A client has an open reduction and internal fixation for a fractured hip. Postoperatively, the nurse should position the client's affected extremity in A. External rotation. B. Slight hip flexion. C. Moderate abduction. D. Anatomical body alignment. The answer is option C. Moderate abduction. 31. Which of the following positions should the nurse place a client for rectal tube insertion? Left lateral position with hyperextension of right knee. B. Left lateral position with hyperflexion of left knee. C. Left lateral position with hyperflexion of right knee. D. Left lateral position with hyperextension of left knee. The answer is option C. Left lateral position with hyperflexion of right knee. 32. Which of the following position is appropriate for the patient to use for self-administration of fleet enema? Left lateral position, right leg flex. B. Face down and leg flex. C. Face upward and leg free. On back and flex hip and knee. D. Chest, knee position. The answer is option C. Face upward and leg free. On back and flex hip and knee. 33. The best position for a child with myelomeningocele is A. Prone. B. Supine. C. Semi-Fowler's. D. Modified Trendelenburg. The answer is option A. Prone. 34. Unless the physician orders otherwise, in which position should the nurse place the infant during the postoperative period of surgical repair of the myelomeningocele? Supine. B. Prone. C. Right or left side lying. D. Whichever position is most comfortable for the infant. The answer is option B. Prone. 35. The nurse is caring for a client with an above-the-knee amputation, aka. To prevent contractures, the nurse should A. Place the client in a prone position 15 to 30 minutes twice a day. B. Keep the foot of the bed elevated on shock blocks. C. Place trochanter rolls on either side of the affected leg. D. Keep the client's leg elevated on 2 pillows. The answer is option A. place the client in a prone position 15 to 30 minutes twice a day. 36. Postoperative nursing care of the infant following surgical repair of a cleft lip would include a. Feeding the infant with a spoon to avoid sucking, b. Positioning the infant on the abdomen to facilitate drainage, c. Applying elbow restraints to protect the surgical area, d. Providing minimal stimulation to prevent injury to the incision. The answer is option C. Applying elbow restraints to protect the surgical area. 37. The client has returned to the nursing unit following a right below the knee amputation. How should the nurse position the client? Supine with head turned to the side, b. With shock blocks placed under the foot of the bed, c. Semi-sitting position with knees bent, d. Left lateral with pillows between the knees. The answer is option B, with shock blocks placed under the foot of the bed. 38. What position should the nurse place the head of the bed in to obtain the most accurate reading of jugular vein distension? A. High Fowler's, b. Raised 10 degrees, c. Raised 30 degrees, d. Supine position. The answer is option C, raised 30 degrees. 39. Which of the following body positions is best for a patient with increased ICP? A. Prone, b. Trendelenburg, c. HOB elevated 90 degrees and hips flexed, d. HOB elevated 20 degrees. The answer is option D, HOB elevated 20 degrees. 40. Immediately after a percutaneous liver biopsy, the nurse should place the client in which of the following positions? Left-sided lying, b. Right-sided lying, c. Lithotomy, d. Trendelenburg. The answer is option B, right-sided lying.
Thank you for watching.